Hello everybody. This presentation is all about abdominal assessment. The objective of this lesson is that by the end of it, a student should be able to perform an abdominal assessment using inspection, auscultation, percussion, and palpation. Abdominal assessment. With an abdominal assessment, you inspect first, then auscultate, percuss, and palpate. This order of assessment is different from the rest of the body systems, for which you inspect, percuss, palpate, and then auscultate. The difference is based on the fact that the physical handling of the peritoneal contents may alter the frequency of bowel sounds and affect auscultation. It is imperative that the abdominal assessment be done in the proper order to ensure an accurate assessment is obtained. Inspection. Inspection consists of a visual examination of the abdomen with note made of the shape of the abdomen, skin abnormalities, abdominal masses, and the movement of the abdominal wall with respiration. Abnormalities detected on inspection provide clues to intra-abdominal pathology. These are further investigated with auscultation and palpation. Some abnormalities could include scars, striae, bruising, visible peristalsis, or a distension scaphoid asymmetrical abdominal shape. Auscultation. Auscultation of the abdomen is performed for detection of altered bowel sounds, rubs, or vascular bruits. Normal peristalsis creates bowel sounds that may be altered or absent as a result of disease. Irritation of serosal surfaces may produce a sound as an organ moves against the serosal surface. Borborygmi is a term for abdominal sound and is a gurgling, splashing sound normally heard over the large intestine. It is caused by passage of gas through the liquid contents of the intestine. Absence of bowel sounds may indicate paralytic ileus or obstruction of the bowels due to torsion, volvulus, or strangulated hernia. To auscultate, have your patient remain in supine position with the legs and lower back supported by pillows under the knees. Expose the abdominal surface and place the diaphragm of the stethoscope directly on the abdomen in each of the 4 quadrants. Auscultation of each quadrant should last for 1 whole minute and bowel sounds should be counted as they are auscultated. There should be 5 to 35 bowel sounds per minute for a normal assessment. Abnormal findings would be hypoactive, less than 5, and hyperactive, greater than 35 sounds. Percussion. Percussion is used to assess the abdomen for presence of fluid or air, as well as identify the shape of position of certain organs like the liver and spleen. Percussion during an abdominal assessment will also alert the healthcare provider to any tenderness or guarding that is present, which would warrant for further assessment and evaluation. Percussing the abdomen gives of 3 results: tympany, resonance, or dullness. Tympany is usually present in the most of the abdomen caused by air in the gut. It is a higher pitch than the lungs. Resonance is a lower pitch and hollow sound, usually found in normal lungs. Dullness is a flat sound without echoes. The liver, spleen, and the fluid in the peritoneum, ascites, give a dull note, but an unusual dullness may be a clue to an underlying abdominal mass. To percuss the abdomen, have your patient in a supine position. Rub your hands together to warm them, then hyperextend the middle finger of your non-dominant hand and place this finger firmly against your patient's abdomen. With the end of your abdominal middle finger, use a quick flick of your wrist to strike the finger on the abdomen. Categorize what you hear as tympanic or dull. Percuss all 4 quadrants of the abdomen using proper technique. Palpation. Palpation is the examination of the abdomen for crepitus of the abdominal wall, for an abdominal tenderness, or for abdominal masses. The liver and kidneys may be palpable in normal individuals, but any other masses are abnormal. Demonstration. This is a video of a brief abdominal assessment. Notice how the healthcare provider uses inspection, auscultation, percussion, and palpation to assess the patient's abdomen. While she does not auscultate bowel sounds for 1 full minute in each quadrant, she does make note of appositive bowel sounds.
Okay, Mrs. Chua, now we're going to move on to the abdominal exam. Okay, so I'm just going to have you raise your gown just below your breasts. I'm going to lower this a little bit more so I can get a good inspection of your abdomen. Just have you bend your knees up so we can relax your abdominal muscles. Good. And again, I'm inspecting for any obvious masses or hernias or pulsations. Okay. Have you bring your head up, again checking for hernias, and relax. Good. Okay, now I'm going to auscultate the abdomen, and we'll auscultate at a minimum at 4 quadrants. Okay, and you have positive bowel sounds in all 4 quadrants. Now I'm going to go ahead and auscultate the aorta using the bell. And there are no bruits. Okay, next I'm going to percuss the abdominal quadrants. And percuss for the size of the liver. And it should be between about 6 and 12 centimeters, okay? Now we'll go ahead and palpate the abdomen, first lightly. Just tell me if you feel any discomfort. Okay. And then a little more deeply. Okay. And now I'm going to palpate your liver. Go ahead and breathe in for me. And out. Good. And palpate the spleen. Go ahead and breathe in. And out. Good. And palpate for the kidneys. And for the kidneys. Okay. And then I'm going to palpate the size of the aorta. And that is very normal. Okay. Finally, I'm going to check your inguinal region. All right. Just have you straighten your legs out. And here, I'm just going to have you hold your underwear to the side. Good. And here, I'm checking and palpating for any femoral hernias, also for femoral pulses, and inguinal nodes. Okay? And then finally, auscultate for femoral bruits. Okay, and we'll do the same on the other side. And I'll just start by auscultating here. Okay, and again, I'm checking for femoral pulses, femoral hernias, and inguinal nodes. Okay? Okay, good.
Next are some questions and answers regarding abdominal assessment. Performing an abdominal assessment is an important part of the nursing process. Performing the assessment accurately and thoroughly can help improve patient outcomes by detecting health problems in your patients earlier, as well as prevent further complications for developing with existing disease. Thank you all for listening to this presentation on the proper technique of inspection, auscultation, percussion, and palpation used to complete an abdominal assessment. We hope this presentation has been informative and provided the information necessary to successfully complete an abdominal assessment.